Thank you so much, John, for joining us today and teaching us a little bit about this health professionals special interest group that you're leading. We at the Movement Disorder Society, I think we're so excited to partner across the society with different types of allied health professionals. And I'd love to hear about your group and, teach us a little bit about who's in it and why people should join it.
Yeah, well, the Health Professionals Special Interest Group, or HPSIG, is really all of the allied health clinicians, all the non-physician clinicians that are working with the same people. Whether it's people in the world of Parkinson's and Parkinsonisms, or Huntington's, or all the other range of movement disorders. And so that covers a lot of ground. And we have 9 professions that we actually recognize in the group, including the regular rehab professions, PTOT speech, and nursing, and geneticists, and dietitians, and even sexual health counselors, social workers, psychologists. I want to make sure I don't leave anyone out, but there's a lot of us in there, and we're all working with different areas in the movement disorders world. So whether that's at a clinic, working under the helm of a movement disorder specialist like yourself, or whether we're doing solo work or independent work. Like, for example, I'm primarily in private practice.
That's amazing. Well, I think, I'm a big advocate for a multidisciplinary team and really collaborating with anyone who can help our patients living with Parkinson's to live better. So I think it's a very exciting group that you've formed. And I know we've already had conversations about how I think in many parts of the world, we don't have neurologists or classic, MDs, physicians trained on the ground in neurology, even, let alone movement disorder specialists. So I think we are just excited that we have other ways to kind of spread the word and help get better care for people living with Parkinson's globally. Perhaps you can tell me a little bit about, on a personal level, John, why you joined the society, why it's important to you, and how it might be something that other folks in the allied health professionals may benefit from.
I first joined, I think maybe in 2010. My first conference was in 2011, and it was really eye-opening to see all these people who were so passionate, like I was, to try to help this community. But more importantly, it gave me a much broader set of resources, and some of that was other clinicians to ask questions and connect with, and some of that is the educational content that's available via our website. If you're a clinician of any type, physician or non-physician, and you're working with people who have Parkinson's or Huntington's or another movement disorder, it really behooves you to be part of the largest overarching entity in the world for specialization in this area. When I look at my team with the HPSIG, with the steering committee, and my co-chairs, Alina Tripoliti and Tarun Amilcar, I think it really helps. It really helps us connect to get better at helping the patients that we want to help, helping the people we work with. So it's valuable for me. And again, I don't work in a big fancy mood disorders clinic, although I wish I did. I'm primarily in private practice, and I couldn't imagine trying to access these resources that I'm using without the MDS, without the International Parkinson and Movement Disorder Society.
Well, I think, as we move towards the future care of Parkinson's, I think we realize that there are far too few movement disorder specialists and neurologists out there in the world, and that we really have to find ways to partner, to really realign and think about how we can serve our patients better. And I think the multidisciplinary team is so much a part of that. We're excited to launch the Wellness Task Force, and we have a whole bunch of folks in the allied health professionals on there as well. So I think we can all work together to help people living with Parkinson's to feel better and live better, in the future. So thank you for your advocacy and your leadership. And it was great to meet you, John, and look forward to working with you in the future.
Thank you, Dr. Subramanian. And I've heard excellent things about that Wellness Task Force. I'm really looking forward to seeing what you do. It's forward-looking, and it's exactly where the society should be looking. So congratulations.
Thank you. Take care.